My name is Srikanth Devi, and I'm an orthopedic spine surgeon here in the Department of Orthopedic Surgery. Historically, in orthopedics and spine surgery itself, outcome measures have been used to track how patients do over time, as well as improve before and after surgery. So unlike a lot of other specialties, outcomes in spine surgery are pretty subjective in the sense that they measure patient functionality before and after surgery. Improvement in things like how long patients can stand or how long they can walk, or how we are measuring success with our surgery. So outcomes assessment is important for assessing safety and efficacy in spine surgery. So outcomes measurements are typically employed by using a questionnaire, and they assess how patients are able to do daily activities. And this helps compare their progress over time or their deterioration over time, as well as compare how they're doing between patients. One good example of why outcomes are used in spine surgery are because it can help guide us in determining what is the most effective surgery. For example, we know with degenerative lumbar spine conditions, we are very good at treating problems related to nerve compression, whether that's debilitating pain or weakness or numbness. By reducing compression from nerve-related causes, we're able to significantly improve patients' quality of life. The same can't be said for axial back pain. For example, we know that surgery for back pain itself is not as effective as it would be for leg pain. So in that sense, we can guide patients and give them expectations before and after surgery by saying surgery is more effective for your leg weakness and leg pain, but you still may have some back pain after surgery. Without patient outcomes, we would have a much harder time differentiating the success of surgery, and that's why this helps differentiating those qualities. So the Department of Orthopedic Surgery here has been using Nih Promise Scores. This was developed by the NIH as a adaptive testing algorithm. How this works is it employs a bank of questions that a patient answers, and by tailoring the next question based on their previous answer, it cuts down on the amount of questions that they overall have to answer. So not only does it create a more accurate outcome, but it creates a shorter one that the patient will be more compliant with. And so overall, it's a win-win for both the physician and the patient, in the sense that the higher compliance and more accurate response. There are a lot of exciting things on the horizon for spinal injuries and spinal cord injuries in particular. There is a lot of research being done in the realm of spinal cord injuries, whether it has to do with rehabilitation techniques or regenerative medicine. The next frontier may be developing accurate ways to decompress the spine without causing further injury. This would significantly advance the safety and reproducibility of spine surgery. So there's a lot of different arenas in spine surgery that can use improvement, and not just outcomes assessment, but also in the field of regenerative medicine, devices, and biologics.